My name is Dr. Supavit Mac Chesdachai. I am a senior associate consultant in infectious disease at Mayo Clinic, and I also assistant professor of medicine at Mayo Clinic. Um, so I had a privilege of serving as the chair of the American Heart Association Science Advisory on the infection of selected nonvalvular cardiovascular device, and I will have Dr. Baddour introduce himself.
Yes, Mac, thank you. Larry Baddour, Professor Emeritus of Medicine, Departments of Medicine and Cardiovascular Medicine at Mayo Clinic, Rochester. It's a real pleasure to be here and to serve as the Vice Chair for this AHA Science Advisory.
Thank you, Dr. Baddour. And I would like to take this time to also thanks the entirety of the writing group for their expertise. So all the author came from the multidisciplinary team that has an expertise in this kind of infection. And then I would like to thank all of them for thoughtful collaboration and commitment to this important project. The reason why this science advisory is needed because the landscape of cardiovascular implantable device has rapidly changed over the past 2 decades. And back in 2003, AHA had issued a scientific statement on cardiovascular implantable electronic device. And then at that time, things has changed. Cardiovascular implantable electronic device itself has their own scientific statement. Vascular graft infection has their own statement, and as well as LVAD or left ventricular implantable electronic device also has a guideline from multiple society. However, there are still multiple devices that has not been mentioned or addressed during the past year. For example, there are multiple new cardiovascular device, for example, vascular stent or the multiple device that help fixing congenital heart condition, prosthetic patch, or any novel device that has not been discussing or review of the literature for a long time. That's the reason why we think that having science advisory will be very helpful for the clinician, even though there's still limit data. I think the opinion from expert and the team will be very helpful in this situation.
It is truly amazing the growth in these non-valvular devices. It's amazing. In some cases, there are thousands of these being implanted in just the United States annually. So that even though infection of these devices, fortunately, is uncommon to rare, depending on the device, of course, it's out there and should be considered in patients with underlying bloodstream infection. And Mac will get into that for a moment, which he and the writing group developed an algorithmic approach to these infections in general.
So I just want to say that the goal for this advisory is to provide the practical and contemporary framework for clinician. For example, if they encounter the case that they concern that have infection, what they need to do. Our writing group review available literature and summarize what we currently know about all of these risk factor, epidemiology, diagnosis, prevention, and management of each device. Even though the level of evidence, as Dr. Baddour mentioned, there may be a case report, case series. However, these infections do happen and also usually have a bad outcome if the clinician or the treating provider cannot recognize. So that's the reason why this science advisory is good for clinician, and also it highlight the importance of the knowledge gap that may need to be addressed in the future as well. So through the paper, I would emphasize that the key summary of the whole paper on the rate of the infection can be found in the figure 1, which is very helpful figure to see that how often that we encounter this infection. And apart from that, we also provide the table that summarize all of the device clinical presentation of infection, common organism that involve in the infection, diagnostic and imaging modality, and also the management, both from the evidence base and also from the expert opinion.
Yeah, I think it's a very valuable advisory because it takes on these devices in a contemporary sense. It gets to diagnostics and an address of PET-CT is one of the up and coming or traditional, and now in some countries, scanning or imaging modality. And then the need for surgical intervention in many of these cases for cure. So even though, as I said before, even though the infections are uncommon to rare, you have to keep in mind their possibility among your patients who have bloodstream infection and no other source is identified.
I want to emphasize on that as well, like with the aging population and then the number of devices that we place, there are many patients who come in with bloodstream infection that we do not know whether do we need to look for the infection of those devices. In this science advisory, we also provide the step-by-step algorithm to see how to approach this kind of scenario. I would like to talk about 3 main take-home message for the clinician based on this science advisory. The first message is that clinicians should remain high index of suspicious of the device infection, especially those patients who come in with unexplained bacteremia or local site of infection with some systemic symptoms after device implantation. And as Dr. Baddour mentioned, the new imaging modalities such as PET-CT is very, very helpful in this situation. My second point is that it is very, very important to involve multidisciplinary team approach to approach this patient because, these definitely should include cardiologists, electrophysiologists, surgeon, imaging expertise, microbiologists, infectious disease, pharmacists, because these patients are so complex and from time to time we will not be able to diagnose that infection by only one subspecialty. And then my third take home point is that the management decision should also be individualized because, again, we do not have a robust data in this field, but it's very important to, discuss with all the colleagues who saw this infection in the past and also, using this advisory as a guide in terms of the management.
Absolutely. And I'd like to take this opportunity to thank Mac for taking this project on, leading the writing group, and providing us a final product that's going to be of great interest today and into the future.
I want to add on that apart from the writing group that I would like to thank, I would like to say thank you to Barb and also Julie, who provide tremendous help in this project, and also our librarian, Dana, who helped look through all of the most up-to-date literature and then make this project possible. Apart from that, I'm also grateful to the American Heart Association for supporting this work. One last thing that I just want to mention is that why should people read this full paper? So I would say that I would strongly encourage everyone, clinician, trainee, researcher who care for the patient with cardiovascular implantable electronic device to read this full advisory, because we hope that this paper will serve as a practical clinical resource while being helpful to demonstrate the research gap. Hope for the researcher to help with that in the future, especially with those with complex infection and doesn't have any prior literature to help with the management. Thank you very much.